So, good afternoon, everyone. My name is Nicholas Trudel. I'm a content marketing specialist at SSU Insurance. I'm pleased to be here today to facilitate this webinar. So, today our webinar will focus on sleep disorders and also in the current context. So, we'll be talking about the COVID-19 context as well. So, let me introduce you to today's speaker, Ms. Regine Denel, psychotherapist and founder and director of the Insomnia Clinic Sam's Sacré-Cœur Hospital in Montreal. So Regina has a master's degree from Université de Montréal in biomedical sciences. In 2000, she founded the Insomnia Clinic at the Centre d'études avancées en médecine du sommeil, SAMS, at the Sacré-Cœur Hospital in Montreal. So, as a licensed psychotherapist, member of the Ordre des Psychologues du Québec, Regine and a colleague she trained have been providing an average of 250 cognitive behavioral therapy sessions per year since 2000. For the past 3 years, Ms. Denel has been interested in telepsychology, and she's worked as a clinical director at the Halio Sleep Clinic, which provides cognitive behavioral therapy sessions via video conferencing to patients across Canada. So before we start, I would like to remind you all that there will be a 10-minute question period after the presentation. So please address your questions directly to me, and you can find my name in the chat section. So all questions sent to me privately will therefore remain anonymous. So without further ado, let's begin the presentation.
Thank you very much, Nicolas. It's a pleasure to be with you today to talk to you about sleep, the advantages of having a good sleep, or to regain good sleep if we have a problem, especially in those hard times we're all going through, and also to see how bad it is when you have difficulties, sleep disorder difficulties. Then it has a lot of consequences, and we'll talk about that briefly. So sleep represents 1/3 of our life. Can you imagine that the average person, a man, will live about 80 years and 84 for a woman, which means we'll spend about 27 years of our life sleeping. So we see it differently if we see it on that perspective. So almost a quarter of a century sleeping means that it must be very important, and indeed it is. Sleep is considered to be the most important element to have a healthy life, and it's important for your health as much as even more than exercise and also eating properly, nutrition. Because if you are sleep deprived, if you don't sleep well, you will not have the energy to exercise. And same thing with nutrition. You will not have the propensity to have a good nutrition if you are sleep deprived, because our hormones that are controlling our appetite will be modified if you have a sleep disorder. So why do we sleep? Well, while we are not, we don't have any, we're not conscious of our environment where we sleep, but it doesn't mean that our body is not active. In fact, it's a very, very active phase when we are sleeping. And there's a lot of things that are going on. And sleep is vital because it's really during sleep that you will have the energy restoration, both physical and mental. This is during sleep that you will have the growth hormone, which is really for the cell regeneration. It's not only, it's important, very important for children and where we are still growing, but it's also important when we are adults. Our brain maturation, the plasticity of our neurons are really working in a different way during sleep, and they are a kind of reorganizing themselves. It's important to sleep for our cognitive ability. Everybody has known bad nights of sleep, and the next day your memory is not as sharp. Maybe you have difficulty concentrating. So sleep is a big help in that area too. There are about 150 hormone secretions that belongs only to sleep, that are done only during the night. And also immunity strengthening. It's particularly important these days because we need to have a strong immunity to be able to resist this terrible virus that's among us. That's not the only answer to it, but it's always good to have a good immunity system, and it really regenerates during sleep. Same thing as memory consolidation and adaptation, because during sleep, especially during REM sleep, when we dream, we are consolidating our memories and the new things we have learned during the day. So it's a very complex and also very fragile system, and a lot of physical factors or mental factors can upset sleep. And a poor sleep is very common, as 48% of Canadian adults will have some kind of sleep disorders. There are a lot of sleep problems, sleep disorders. You have here a list, and every subset of those great categories would need at least 30 minutes to explain. So today we will focus on insomnia, because this is the most prevalent problem. So insomnia, occasional insomnia, will happen to almost 50% of the population. Half of us will have occasional insomnia, but it becomes chronic. And the problem with insomnia is when it becomes chronic. And the percentage is quite high. Between 12 and 17% of people having insomnia, it will become chronic. And it's been raising every year. About 5 years ago, we were saying 10 to 12%, and then it's been 12 to 14, and now it's 12 to 17. And no matter how high these figures are, I believe it will increase, especially with the crisis of COVID-19 that we are having now, with the stress and the isolations. Probably insomnia will get even a more prominent disorder. So insomnia, we have different type of insomnia. We divide them by types. We talk about initial insomnia, when the only problem is that you cannot initiate sleep properly rapidly. But once asleep, those people will be fine, but it may take over an hour to fall asleep. Then there is maintenance insomnia, that usually is more with midlife, the age after 50, you will have probably more maintenance insomnia than initial insomnia. So those are difficulties staying asleep. You may fall asleep easily, but maybe 3-4 hours after that, you will wake up, and then you have a hard time returning to sleep, or you will have a lot of awakenings during the night. And then terminal insomnia is when you sleep quite well, but like very early awakenings, like 4:30, 5 o'clock, you wake up on a regular basis, and then you're not able to go back to sleep, even if you feel that you need more, that you're tired, and you have the good conditions to go back to sleep, but you can't. And sometimes it's a mix of all this that you can suffer from. Insomnia is a subjective sleep complaint. People complain about insufficient sleep, poor quality of sleep, too much light sleep, and it has to have daily consequences. And it's usually with psychological distress. People report fatigue, drowsiness, problem with their concentration, memory, and their mood. They are more irritable, impatient. Sometimes also some somatic complaints with headaches and digestion problem. And all the measures of quality of life, when you have a test for those, there are some, SF-36 is a very special test for that, you will see that all the parameters of the quality of life have decreased, reported by the people that suffer from insomnia. And social withdrawal. If you have been struggling through your day from the morning to have to go at work, when you come home, you're not very entitled to have a good conversation or to go out, go to the movies, have people at home. So social withdrawal is quite often noticed in insomnia, and especially these days, we are in kind of a forced withdrawal of socialization is decreased. So it's very important to keep social contact. Okay, and for the insomnia to become chronic and severe, it has to at least be present more than half of your week, equal or superior to 3 nights a week, and last for 3 months. Then we are talking about chronic insomnia. Insomnia is also quite a high risk factor for developing other psychological disorders, mainly major depression. You can see those figures, and also anxiety disorders. And insomniac will consume more alcohol or smoke cannabis to help them sleep, and use sometimes drugs. And depression and insomnia, it's a kind of bilateral influence, because it's a two-way street, because depression when you diagnose, you have a diagnosis of depression, sometimes insomnia was there months before really the onset of the full blow of major depression. And having sleep problem is also a criteria for the diagnosis of depression. And if the sleep is left untreated, insomnia can make the depression very hard to treat. There's an augmented risk of suicide. And which is even more interesting to know is what when insomnia persists after the depression, the remission of depression is done, and if it's the sleep problem is not addressed, then the patient is twice as likely to have a relapse. And it's been shown also that about 73% of the people that take antidepressants like citalopram, it's almost 3/4 of them that will remain with sleep problem at the end of the treatment. So it's very, very prominent. It's also a very strong impact on physical wellness. There's been a link, strong link, associated with insomnia and heart disease and high blood pressure. It's been shown that if you sleep less than 6 hours, you will have a high risk, according to the Sleep Heart Health Study, to have high blood pressure. And there's also a link, very interesting link between insomnia and obesity. And if we do in research sleep deprivation, even partial sleep deprivation, you will have two hormones that are secreted during sleep, the leptin and the ghrelin. Those two hormones, the leptin is decreased below the normal level, and this is our satiated hormone. It means this is the hormone that says, I'm full, that's enough, you had enough, and you have a sign that really you cannot eat or you shouldn't eat anymore. And on the other hand, the ghrelin, it's the hunger hormone. It will tell you, oh, I'm hungry, I need to eat more. So the two of them working together, and also the rhythm of the function of your digestion is also modified when you don't sleep well. So that's a risk for obesity. Talking now about economic burden of insomnia. Well, it was estimated in 2009 that the direct and indirect cost of insomnia, just for Quebec only, was estimated at 6.6 billions. In the United States, I think it is 13.8 billions per year. So it's enormous, it's huge. And the indirect cost of insomnia we call absenteeism and productivity. They cost, in fact, to the industry 10 times. They are 10 times higher than the direct cost of insomnia therapy. That's to be considered. If we have sleep deprivation, it will affect our cognitive abilities to about 50% of what we are capable when we sleep well. And if we compare insomniac versus good sleeper, there is an increase of presenteeism, which means you go to work, but really you're not functioning well, far from your maximum productivity. And it's increased by about 25 days per year. Same thing, big costs associated with accidents and mistakes. 20% of the drowsiness at wheel will cause accident. We have 2.5 times more risk of having a car accident, motor vehicle accident, if you're an insomniac. So this is something very frightening. If you drive and you're sleep deprived, your risk of accident become very, very high. It's been estimated that for each employee, the annual cost of productivity, which means you won't be as effective at work, it is estimated at $5,000 per person. And that person will also use 75% of Medicare care costs. She will go more often to see the doctors, not necessarily for insomnia, but they will report all kinds of problems associated with it. So now, the good thing about it. Well, we came up with 10 recommendations. It's not like the 10 commandments, okay? To remain or regaining satisfying sleep or maintaining good sleep. And what's so good about it is that the 10 of them are working together, like in synergy. So it's not if you make one or two or three, maybe that will not be enough. But if you turn to observe the 10th recommendation, pretty sure that you will regain a satisfying sleep. Okay. The first one is to make sleep a priority. prioritize your sleep. This is usually what we cut easily on the sleep. We have some work to finish, a late movie to watch, listen to music, any activities in the evening that keeps you prolonging the day and not going to sleep is not a good idea. So it would, an adult, you will see in another slide, an adult should sleep between 7 and 9 hours per night. The second recommendation is to maintain a bedtime and a wake-up routine regular, even on weekends, which is not that easy. But the safe side, I would say, have a regular bedtime and rise time during the week, and maybe in weekends you can indulge in staying more in bed or getting to bed a little bit later. But remind that if you go over 1 hour compared to your regular weekdays, then it's like having jet lag. So we don't think about that. But the more we make a yo-yo difference between the weekends or even the weekdays, well, it's an adaptation of our old clock system on a daily basis. When you wake up, it's very good to expose yourself to bright light, especially natural light, but it could also be artificial light, because this is a way to resynchronize our clock. And it has to be synchronized on a daily basis. And it will send a strong signal to your brain that it's day, even if you didn't sleep well. Get up, have the light, and you will recuperate the sleep debt and you will sleep more deeply the next night. So it's very important to expose yourself to bright light. But on the contrary, at night, about 1 hour before bedtime, it is a very good idea to dim light in your environment. And a very special recommendation that most people are forgetting now, you should abandon your screens like telephone, iPads, your computer. This should be closed completely a minimum of 1 hour before bedtime. It is recommended 2 hours. Even if you have shields to dim the light, it is enough, and no one on the market up to now is efficient enough to block the blue light that will send to your brain a signal that it's still going on, the day isn't finished, and melatonin will not start. So it's very important to have bright light in the morning and dim light in the evening. Have a good nutrition, eat healthy and at regular times. It's always recommended to have a good, of course, good meals, good nutrition, healthy meals. But the regularity of time is important. Same thing. It is everything that is a ritual, a regular schedule will straighten our biological clock. And here I come to the biological clock. This you've been told just a few minutes before that what's recommended is for an adult is between 7 and 9 hours per night, but there are long sleepers that need more and short sleepers that need less. And when you get older, maybe an hour less would be also adequate. So here, maybe my most important slide to teach you how sleep works. Because no matter where you were born, it should be in Canada or in Russia or in China, it is the same basic physiology for every human being on Earth. And our sleep is under the control of two regulators or two sleep-wake cycle regulators, processes. And the first one is the circadian rhythm. This is a biological clock. And it works that way. If you can see my pointer, your eye here will receive a signal of light, different intensities of light. And that information will travel along your optical nerve and go in the middle of your brain in the hypothalamus. And this is where our biological clock is. It's called the suprachiasmatic nucleus. He's like the maestro. He's like the chef d'orchestre. He will send messages all over your body, okay? In the pineal gland for the melatonin, for the temperature, for the melatonin, for the cortisol, for the hormone, for the prolactin, 150. So he's the master of ceremony. He's the boss, Okay. And two of our, I should say, more robust signal of his influence is the control of our temperature and the melatonin. You have the temperature here in the red. What happens for every one of us, it's that in the morning, our temperature will rise, will start to rise. We will have a dip in the middle of the afternoon, after lunch. This is why we call it usually post-lunch dip. So you have a propensity to sleep or doze or do a siesta, which is a good idea. And we don't use that much, but maybe on weekends. And then our temperature will continue to rise, and the maximum will be in the evening. Then it will start to descend. Yeah? And then it descends when the melatonin in blue will start. During the day with the light, there's a complete inhibition of its silence, there's complete inhibition of melatonin. But when night comes, oops, sorry for that. When night comes, it will start maybe a little bit earlier if you're an early bird, maybe a little bit later if you're a night owl, but it will start to have its own dip over the night with a maximum in the middle of the night while the temperature is at a minimum. Then it will decrease again and we go for another cycle. So you can realize that having regular rise time and bedtime will strengthen this rhythm, which is a very good thing for sleep. The second process that is at work with the circadian rhythm, we call it homeostatic drive, process S. And what it says is that the propensity, the sleep pressure, will augment with the hours that we are awake. So the more hours we spend awake, the greater the sleep pressure will be. This is why we recommend to go a bit later. If you have sleep problem, if you go to bed 1 hour later, even if you feel tired, you have a better chance to fall asleep quickly. And when we sleep, well, it's like a balloon. All day long, you are inflating your balloon, and the more your balloon is strong, the more you will go to sleep quickly and have a condensed, consolidated sleep. If you and when you sleep, it's like deflating your balloon. The pressure for sleep decreases. You have an example here of somebody that would rise at 7 o'clock in the morning, and all day the sleep pressure is building up. It's like when we are awake, we have those substances that accumulate in our body, and that progressively will tell us we really need to sleep now. Okay, so sorry for that. And then when we go to sleep, it's like erasing our sleep debt. And then we go for another day. But there are also external pacemakers. We are regulated with meals, especially when we work. Okay, we have to wake up and go to work at such a time, or meals at such a time. We work from 9 to 5, then we exercise usually after work. So we are really resynchronized on a daily basis. We are resynchronizing all our body clocks with those external messages. So the more habits, rituals you have, the better for the sleep. Now, the 5 other ones. Regular exercise. Exercise is very good at large and particularly good for sleep. If you do exercise in the morning, even if you had a bad night, the light and the exercise will really start the machine. You will feel energized, and it's a strong message that it's daytime, and then we go with the activities. Okay. And if you want to help you sleep, the best time to do exercise is at the end of the afternoon or beginning of the evening. Because if you do a good exercise at that period, you will generate endorphin, which is a special hormone that will also help to have deep sleep when you fall asleep. Well, this is really what we wish. But something very important is to avoid physical activity 3 hours before bedtime. Because if you have autonomic activation, it will not be easy to fall asleep. So avoid exhaustive 3 hours before bedtime, but very good at the late afternoon or beginning of the evening. Establish a routine, a relaxing bedtime ritual. This sometimes we forget because we think we have to prolong our activities that are pleasant up to the latest part, and then we go to bed and we flick the light and we should sleep like this. That's not how it works. Think about what you do with your children, and when they are fighting in the living room or running around, you will not take them, go to bed, and close your eyes and sleep. We usually have a ritual. Maybe they will take a bath. Maybe you will dim the light in their bedroom. Maybe you will tell them a story. So we should do the same thing for us. We should engage in a relaxing bedtime ritual. Okay. And the number 8 is a very tough one and maybe a counterintuitive one, but is this so important? We should fall asleep within 15-20 minutes or regain or return to sleep if we have wake up within 15-20 minutes. So if that's not the case, we should not stay in bed. We should leave the bedroom, go outside, and wait for drowsiness, signs of drowsiness, or maybe about 30 minutes after you spend outside doing a boring activity. Do something to keep your mind a little bit busy, but nothing to activate yourself, like drawing, listening to music, anything relaxing for you. Okay. And then you go back to bed. And in case sleep is not there again, you should get out again. So it seems people say, oh, at least if I don't sleep, I'm resting in my bed, which is not a good thing. It's an immediate advantage if you want, but at the long run, it will desynchronize your clock. So we want to reassociate the bed with sleep. So if you don't sleep for no matter what reason, it's better to be outside and resume your bed and sleep when you're feeling drowsy. Maybe you could discover, some people say, I never nap, I cannot nap. But maybe when you are in a period, like for example, for now, some people are working on first line doctors, nurses, they are working long shift, they're exhausted. So maybe they would benefit for short naps. Anyone can benefit from a short nap, but it has to be short. That's the essential. Maximum 30 minutes and not after 3 o'clock, like between noon and 3 o'clock. Otherwise, you will have an impact because of the building of the pressure will be deflated by the siesta, by the nap, and you have to rebuild your sleep pressure to be able to fall asleep quickly. And learn to manage stress. Well, I think everybody these days is under stress. Stress is a normal reaction. It happens when your brain thinks that there's a danger, be it real or not. You perceive, and it's well. It gets your body prepared for any fight or good or reaction that would be appropriate for your to keep healthy. So it's maybe time to use relaxation techniques that you have been learning, or you can find a lot on the net, and maybe meditation. It could be also that you shut yourself to the bad news. Maybe you listen to the news once a day at around noontime, but the afternoon or late afternoon you don't, because that will make your anxiety rise. Okay, so you also may reserve, let's say, an hour or some time during the day to think about your problems. Try to find solution, even if they are partial, if they are temporary. Share your worries with somebody else. Keep contact with the other ones, and those are good ways to manage stress. But if you try all this and your insomnia doesn't resolve, then there might be another problem. And it's a good idea to consult a professional to detect eventually the presence of primary disorder, sleep disorder, like obstructive sleep apnea or restless leg syndrome. And only your doctor can refer you to a center to have it to eliminate such a problem. Drug therapy, pharmacotherapy can be useful if you have a terrible acute insomnia. It should be only recommended by your doctor, and it should not last more than a month. This is not usually what people do, but it's how it should be done. And please do not use the over-the-counter like Sleep Ease, Benadryl, Gravol. Those substances are addictive and they can have side effects that are quite serious, and so they should be avoided. And you can engage in CBTI, cognitive behavioral therapy, with a therapist. The CBTI is now the first line of treatment for chronic insomnia in adults. It's been recommended by the European Sleep Research Society, the American College of Physicians, the National Health Institute. So there's no doubt that it's the best approach these days. But it's a demanding therapy. It requires motivation, dedication, but the reward is that usually 80 to 85% of people will have an improvement with that. CBTI resources are very sparse, I'd say. Usually it's done in private clinic, like we do at Sacré-Cœur, Center for Advanced Research in Sleep Medicine, and in Quebec City, Center for Études des Troubles du Sommeil. But outside those two big cities, there are very few resources. We can find only in English, to my knowledge, digital sleep improvement programs. Those are like little capsules telling you, giving you advice, and like Sleepio, that's been developed in England, and Shuthai. And there's also now telehealth clinics with qualified therapists. It's like not face-to-face in an office, but it's face-to-face, just like we're doing now. And Aleo Online Sleep Clinic has been my interest over the last 3 years. And we have fantastic results because it's exactly the same success result that we have in face-to-face therapy. So it's been now published in a very good reviews, scientific reviews, like Lancet, for example, that there is room for new digital cognitive behavioral therapy because it works really well. Now, I will take a few minutes to talk to you about other syndromes like the apnea, which is important because 25% of the population over 60 will eventually suffer from sleep apnea. It's more frequent in men, and the diagnosis would be at home or in lab polysomnography, and it has to be recommended with your doctor. But when should you go and see your doctor? When if you have those clinical signs like snoring, or usually it's a bed partner that tells the person that's snoring that it's a big problem. You may experience daytime drowsiness. You may have pain in your throat when you swallow in the morning or headaches. Your mood may be affected. You become more irritable or depressed, and you have difficulty concentrating, cognitive problems. But it has especially a devastating effect on your health, on your physical health, much more than insomnia. Every people that has an obstructive sleep apnea that is not treated will develop hypertension, will be at high risk of right heart failure, arrhythmia, strokes, and also those cognitive deficiencies we were talking about. The gold standard treatment is CPAP, continuous positive air pressure. The airflow will open the resistance in those areas in your throat and force the air in with the pressure that is measured according to the resistance. This is used for, let's say, moderately severe to severe sleep apnea should probably have a CPAP treatment. If it's mild to moderate, there's also those splints, mandibular splints. It's like something that will advance your mandibular so that the airway is set free. Weight loss. People that are overweight are much more at risk of having sleep apnea, and sometimes losing 10 pounds or 15 pounds or 20 pounds will make the apnea completely disappear. The other symptom I want to talk briefly about is the restless leg syndrome. It's a neurological movement disorder during sleep that affects about 15%, 10 to 15 of the general population. It is usually genetic, and the treatment is really drug therapy. But what about the symptoms? They are clinical, and everybody can recognize the symptom if they suffer from restless leg. They will have this uncontrollable urge to move, usually associated with unpleasant leg sensation, tinkling, pulling, and people say, I have worms in my legs, all kind of expressions. those symptoms are more worse at rest, and usually they start in the middle of the afternoon and get worse all over the evening or during the night. And people usually walk during the night because it is temporary, but usually almost completely relieved by movement and especially walking. And a little warning here, antidepressant, all of them except one, will increase the severity of the symptom or even trigger them. So to resume, I think there's three components of a treatment program for sleep disorders. The first one is awareness and education, and this is exactly the aim. This is what SSQ is doing with those webinars, informing people about all kind of problems. Today was about their sleep. And so prevention guidelines, the impact of sleep disorders, being educated on that helps you seek treatment. There's also the testings, some self-administered online questionnaire to evaluate drowsiness, to evaluate, that is my last slide, in fact. Psychometric scale to see if you have a depression scale, normal, or anxiety, medical exam, and then the treatment, because all this is not used. If you have a problem, it has to be treated. So drug therapy would be for the RLS or insomnia in acute phase, no more than a month, CPAP for obstructive sleep apnea, and cognitive CBTI for insomnia. And I thank you very much for your attention.
Thank you so much, Ms. Danelle, for this resourceful presentation. We are now ready to take questions, and we did receive a few while you were talking earlier. So I'm going to address them in order that we've received them. So we're going to take like two or three because we only have 4 minutes left.
Yeah,
so the
sorry.
first, is that okay for you?
That's fine.
Okay. So the first question that we've received is about the use of cannabis in order to help fall asleep. What would be a professional opinion about that?
Yeah, there are still very few studies, serious studies about cannabis. What we know about cannabis for pain is quite useful. So if you don't fall asleep because you have pain and you take cannabis, it may really help you. But just as a sleep aid or instead of a sleeping pill, well, it's been shown that you have the same dependence that really builds up very quickly. And then when you stop cannabis or reduce it, you may have anxiety and sleep problem rebound.
Okay.
And on a young brain, it's been shown that the volume of the brain, if you smoke on a regular basis, may have a certain shrinkness, which is for sure is no good.
All right. All
This is
right.
why
Thank
we
you.
recommend that even if it's legal, not this is why we recommend the psychiatrists recommend that it's not you do not touch cannabis before 25 because your brain is not mature before that age.
All right, thank you. We have another question. So we did talk about how difficulty sleeping can cause digestion problems, and someone wonders how bad can the digestion problems be for someone who has difficulty sleeping, and can pain in the abdomen be due to lack of sleep, especially if a test was done and it showed that nothing was wrong?
Okay, well then I would say that probably the digestion problem is more stress, nerves. Okay, if you overstress, your digestion will not be good, will not be as efficient. So anything that could help you with relaxation, okay, that would probably help also for digestion. And it depends if you had very irregular meal schedule. And if you don't have any obligations, so you hit a little bit here, a little bit there, and you're not careful with what you eat. If you overeat, right, before sleep, it's not so good. We recommend that we do not eat at least 2-3 hours before sleep. Okay?
All right.
Same thing with the alcohol. We should be very careful with the consumption of alcohol that usually increase in this period. It's been reported.
Okay, well, thank you. We have time maybe for one last question. So would you recommend melatonin for occasional sleeplessness?
That's a very good question. Thank you, because I forgot to talk about it. No, it's a big no. Melatonin is not a sleep aid. Melatonin is useful for resynchronization of the sleep.
Okay.
So if you have jet lag, if you work a night shift, melatonin may be an help, okay? But as a sleep aid, it's no. The good thing is that it's not expensive. And even if you take like 10 milligrams of melatonin and you realize, as I tell you, you believe me that it's not useful for your sleep, you can quit it from one day to another. You don't need a tapering period for that.
Okay, so no addiction.
No addiction.
All right. Well, thank you, Regine, and thank you everyone for your participation to today's webinar. So as mentioned earlier, I'd like to remind you all that this webinar will be available on our website within the next 24 hours, and it will be available at ssq/en/virtual meetings, and the address is also in the chat section if you would like to check it out right now directly by clicking the link. So thank you guys, everyone, and take care and stay safe.
Thank you very much. And thank you, Nicola, for your help.
You're welcome. Thank you.
Bye.
Bye-bye.